welcome back to Reclaim You. I'm so psyched to have Rachel on the podcast today. We're talking all things eating disorders and medical care and lots of offshoots of that topic. So welcome, Rachel.
Thanks, Sarah. Thanks so much for having me. I'm so excited to be here and talk about all things eating disorder and medical and therapy, and we'll be them all together.
Love that. So to start, I'd love to just ask you, what does Reclaim You mean to you?
Oh my gosh, I've heard you ask this to so many different people, and it's like so cool to be able to answer it for myself. It's such a good question. I feel like it's such a broad question, too.
I know, right?
I know. But when I think about the word reclaim, I immediately kind of think about like if we often have the chance to like claim anything for ourselves to begin with, right? So like I feel like the pressures of society and diet culture and family systems and hustle culture and performance culture and all the systems of oppression, right, are like influencing people at a younger and younger age. And it's like, do we ever truly have a chance to like claim to begin with our own needs or wants or desires from the start? Right. So I think almost reclaiming to me means like engaging in a little bit of self inquiry and understanding and questioning beliefs and narratives or patterns that maybe you've been taught to just sort of go along with, but maybe like somewhere deep down they feel wrong or not aligned or like dehumanizing or objectifying or upsetting in some way. And I think too, right? Like, since we are going to be talking about all things medical today, I think reclaiming you in the sense of a medical setting or in the medical world is really just reclaiming like your sense of humanness and your sense of worthiness outside of our medical system's really rigid definition of health and really rigid criteria for being healthy or having health. And I think it's, like recognizing that and having that deeper knowing that like you are so much more than a set of lab values or test values or diagnostic codes, and like we can never reduce a person down to a set of medical data. So that's what I would say, I think.
That's such a wonderful answer. And yeah, you're the perfect person to talk to about this because of your background as a dietitian and, being back in school to be a nurse practitioner and do some primary care stuff. So to have an eating disorder informed primary care provider is like so special, so hard to find.
So hard.
And yeah, so I'm so glad that you're here talking about this. Why is it important for a medical provider to be eating disorder informed?
Oh my gosh, it's so important. I think that like the first thing too that comes to mind is I really like to use the term eating disorder aware and eating
Mhm.
disorder conscious
Mhm.
in addition to eating disorder informed, because I think sometimes, right, like the term informed can be this way that providers can kind of almost like intellectualize information and
Mhm.
sort of weaponize it almost, right? Like I have all this information, but I'm not actually acting in alignment with the information that I have. And I
Mhm.
think we'll go into this today, but right, I think that speaks to like our own internal biases, right? Sometimes, and I talk about this a lot with clients too, but is almost like that head to heart disconnect that happens so often in eating disorders. We could also say like cognitive dissonance sometimes, but I really like to do it as like head to heart, right?
Mhm.
So it just does not kind of translate into what we're doing. But yeah, I think that being eating disorder aware and conscious is actually like the way that we practice, not just the knowledge that we
Mhm.
have. So I think it can be a little bit different.
Yeah.
But I think
Yeah.
that like being eating disorder aware, conscious, or informed just means that like you are actively acknowledging that eating disorders and disordered eating do not discriminate based on body size or age or race or ethnicity or gender or sexual orientation or socioeconomic status. And like truly like deeply deeply knowing that any person who walks through your door could be deeply struggling no matter how put together they look or you know how they're appearing or what their body size is or again like how they're presenting, and just knowing that we can never make assumptions and we have to be curious and we have to be
Mm.
asking questions.
Yeah, that's so important. And I know in the folks probably listening know that going to medical providers that aren't coming from that place and aren't just curious and open and looking for, different symptoms or, concerns, distress, suffering, they miss so much, right? And if your provider is missing something or diminishing something, that has a really serious impact in your sense of self or your relationship with your eating disorder and what's real and what's not and who's sick enough and who's not. It's really, really important.
Oh my gosh, yes, totally. Yeah, I think that's such a good point, right? And I also think it's important too to acknowledge that like even if your primary care provider like is eating disorder informed or aware or conscious or whatever word we want to use, right? Like they might still not be specialists in eating disorders,
Mhm.
right?
Truth.
So there's a big difference between being aware
Truth.
and informed and then like specializing in something as complicated as an eating disorder. And I think that like having a medical provider who is aware in and of itself is like a huge privilege,
Mhm,
right? And also like having a medical provider who is a specialist in eating disorders
mhm,
is such a privilege,
mhm,
and it's so inaccessible for so many different reasons, right? But just noting that being aware does not mean that they know everything about eating disorders.
mhm.
And it does not mean that they have like a really deep expertise in eating disorders. And I think just having that like acknowledgement and humility, like it doesn't make anything that they say that could land poorly or not, align with what you're needing in that moment any better. And
Mhm.
also, right, like eating disorders are so complex, and even people who do specialize in eating disorders, like they miss the mark sometimes
Yeah.
because it's just so challenging.
Mhm. Yeah. And I think in my experience, it can be difficult to really, support folks to go see their care team, right? Their docs, their specialists, things like that. And at the same time, we know that in most eating disorders, that it's important to have some medical oversight and to make sure that the body is okay along with the mind, right? So can you speak to a little bit of why it's important to have regular check-ins with medical providers while you're navigating recovery, whether you're new in recovery or in recovery for a long time?
Yeah. Oh my gosh, totally. I'm so passionate about this. So, I mean, I think like one thing that we can acknowledge, and some people probably know this statistic, other people might not, right? But eating disorders are the second most deadly mental illness after opioid use disorder. So, there are a ton of mental health and medical complications that come with eating disorders. So, it really is like a team approach, right? Like, the more support, the better. And I think that the first thing that comes to mind with this, right, is like if you can find a primary care provider, whether that's an NP, that's a nurse practitioner, or a physician assistant, or a medical doctor, or, a DO, whatever it might be, like that's just another source of support, right?
Mhm.
That's like another bubble in between yourself and the outside world that can be so activating and triggering for the eating disorder. So I almost like to, this is from my supervisors, I did not come up with this, but kind of thinking about like ourself in this bubble with you in the middle, right? And then creating, right, these bigger bubbles kind of around you. And the bubbles kind of represent different levels of accountability and support, whether that's accountability for, attending appointments or following your meal plan or, like feeling your emotions or whatever. But like the more that we can kind of almost protect ourselves and kind of put ourselves in that place of safety, I think the better. So I think it can just be another source of awesome support, and it can be a way to combat the eating disorders constant dialogue around not being sick enough
Mhm.
until XYZ happens, right? So an eating disorder specialized doctor can help provide you with some medical knowledge to be able to kind of, combat again, like why certain bodies and certain people show various physical outcomes of eating disorders and why others do not. And I think that that can help increase motivation for recovery when a skilled provider is able to say, like, that the body and the mind is not just fine, quote unquote,
Uh-huh.
right? As a
Uh-huh.
result of the eating disorder, even if the person is still technically able to like function each day and go to work or go to school or take care of others or engage with their day to day routine in some capacity, right? So they can really help with that understanding of like, your body is so resilient. These are the compensatory mechanisms that your
Mhm.
body does in the face of, you know, starvation, malnutrition, restriction, any kind of purging behaviors, right? So your body is kind of compensating for your compensation in some ways. Wow, like how miraculous, how resilient, how incredible is that? So I think
Mhm.
it can be helpful in that sense, just to have somebody else in your corner that can
Mhm.
speak to some of like the medical rationale and, you know, the medical
Yeah.
complications that can come up that can make it so challenging.
Yeah, definitely. And even stepping outside of like lab results, right? Like we know that someone can have like normal, quote unquote, normal labs and still be very, very sick because of their eating disorder or suffering a great deal because of their eating disorder. So it does feel so important to have someone who can speak to this connection and the toll that disordered eating behaviors or eating disorder behaviors are taking on the body and on the nervous system, and how everything is so connected. And, what something happens over here, and so something happens over here. And when we're not super aware of that, it can be easy to just kind of like go through the motions and say, like, oh, well, my labs are fine. Like, I'm not sick enough. This is okay. Right. And a lot of times, I think that's the message that gets taken home is that, well, when my labs are bad, then I'll be sick enough to get treatment, to get help, to whatever, when really like the suffering is real, even when things are quote unquote normal.
Yes. Oh my gosh, yes. I love that. Right. I always tell my clients to like eating disorders are mental prisons. Right. And I think that like one thing that can come up a lot of the time if a medical provider unfortunately is not eating disorder aware, conscious, and or does not have eating disorder specialization expertise is sometimes, right, when we've been working so incredibly hard to do recovery and to, you know, really follow our meal plan, to do that metabolic repair and healing, to heal every single organ system that's impacted by an eating disorder, is that then that doesn't make the eating disorder go away. And what
Mm-hmm.
we know from research, right, is that usually in eating disorders, physical health, quote unquote, right? Like the physical complications of eating disorders typically heal faster than the mental, emotional, the nervous system components of the eating disorder. And so, unfortunately, I think what can happen sometimes is when medical providers are not aware of that, and then we, you know, say things or send the message of, oh, well, look at this. Like your labs are so much better. Your heart rate is up, right? Your blood pressure looks really good. It can kind of invalidate that suffering that I think can actually be like the worst of both worlds sometimes, right? Like
Yeah.
I'm
Yeah.
now in a medically stable body and I'm so deeply still in this mental cage, this mental prison trapped by the eating disorder. And that can feel so uncomfortable,
Mm-hmm.
right? And so having a medical provider that can acknowledge that and hold both, right? And acknowledge that like there can be grief and loss with becoming medically stable again.
Yeah. Yeah, absolutely. And as you were saying that, I was also thinking of how it's also so important for medical providers to collaborate with the treatment team, right? Because there's so many people doing lots of different ways of supporting someone, and without kind of reaching out and sharing and discussing and conceptualizing together, so much can be lost, right? Where
Right.
people just like, oh, you're better, you're recovered, like, okay, cool, next, like, move on, keep it moving, when really the treatment team could be seeing something a lot deeper because of their relationship with the client.
Yes. And I think that like too, another part of this whole conversation is being eating disorder informed, right, as a medical provider means having the humility to be able to coordinate care with other disciplines.
Mhm. That's for sure. Yeah.
Right? Like, I do not know everything that there is to
Mhm.
know about nutrition or, you know, the medical complications of eating disorders. Maybe there is something to learn from a dietitian who is specialized. Maybe there is something to learn from a therapist who is specialized, right? And
Yeah.
so I think that like a good provider will be curious about what they don't know,
Mhm.
not only in a sense of being able to, you know, coordinate care, because I do think, right, like the gold standard for eating disorder care really truly is having a really solid therapist, right? Having a eating disorder specialized dietitian,
Mhm.
having a psychiatrist, and then having a primary care doctor.
Mhm.
That's intense,
It's a lot.
right?
Mhm.
It's so much. and to really kind of hold that as a privilege to be able to coordinate care for people in such a nuanced and vulnerable way, right? Like eating disorders are so complex and it's a really vulnerable time for people to be entering eating disorder treatment and for them to even be able to kind of accept that help or support. So I think it's so important for us just to like, as medical providers, myself included, is check
Mhm.
our biases and always have humility. And it's like, I don't know everything.
Mhm.
I know nothing sometimes, right?
Mhm.
And there's always something to learn from every single other person of the treatment team. And the best eating disorder providers, even if they're not specialized or have expertise, are going to want all the information. They're going to be so open to it. They're going to be so committed to learning and really understanding not only, like I was saying, from the providers, but also from the
The
client.
client, most
Because the
importantly. Yeah,
Yes, the client's lived experience is the most important thing. We can have all the certifications in the world, and if we're not actually addressing the client who's in front of us and telling their personalized story, it doesn't matter.
totally. Yeah. Yeah. And I'm thinking about the biases around, biases and beliefs around like binge eating disorder. This isn't something that we talked about talking about, but it just came to my mind about a lot of times folks who are struggling with binge eating disorder, which is often also like could be qualified as anorexia, right? They don't seek help because they're not considered, right, quote unquote, at risk, maybe due to body size or because of, the concerning, quote unquote, concerning behavior is the binge and not the restriction. So it feels important to kind of name that because I think often the folks that I've worked with over the years with binge eating disorder are kind of like I'm fine. They're just going to tell me to, go on a diet or to, lose weight or to do whatever it is so that I stop binging when that just like propels people straight into the
Mhm.
eating disorder.
Yeah, no, as I was like preparing to record this podcast, I was thinking a lot about that actually. I have so many clients too who have been misdiagnosed with binge eating disorder and they're actually struggling with anorexia or
Mm-hmm.
they're actually struggling with, I don't love this term and I don't use it in my practice, but like quote
Uh-huh.
unquote atypical anorexia. And that's just, I mean, we can name it, right?
Yeah.
Anorexia with the side
It's
of
just
like
anorexic.
stigma.
Oh, totally.
It's
Yeah. Uh-huh.
right? Or they're struggling with bulimia, right? And
Mm-hmm.
because of their body size, they're diagnosed as binge eating disorder
Yep.
without any other questions or curiosity or inquiry into what that's looking like for them. And just for the record, right, like binge eating disorder can occur in any body shape or size, right? Just
Mm-hmm.
like any other eating disorder, you do not need to be in a large body to have binge eating disorder. Some people are in smaller bodies who have binge eating disorder. And I think that's just really, really, really important to name. And I don't know, I've actually done like a lot of reflection on this too of like, we know that the biggest driver for binge eating disorder is restriction,
Mm-hmm.
right? So it's like, where is that line? Like, I think what happens in my brain is like, I would diagnose a lot of patients. I mean, I can't formally diagnose right now, but as having anorexia because the restrictive thoughts, right? The mental restriction, trying to restrict types of foods throughout the day and quantities of foods throughout the day. And we have all those thought patterns and, um, kind of mental dialogues that anybody with we would see in anorexia would have, but then
Mm-hmm.
their body is just kind of overriding them at some
Mm-hmm.
point, whether that's each night or at the end of each week or at the end of
Mm-hmm.
each month or what have you, right? Saying that, this is not sustainable for me anymore. So
Mm-hmm.
I don't know. I think that like the diagnostic criteria too for binge eating disorder and anorexia just sometimes does not make sense to me.
Oh yeah, it's just not it, right? It's just not it.
Not it.
There's some work to be done around that for sure. I feel like that's a great place to talk a little bit more about weight stigma and why even, I don't some people haven't heard of weight stigma, right? So it's a good opportunity to share about why it's so important to name it, talk about what it is, how it impacts folks, really literally everyone. Everyone, but
I
also in the medical field.
Yeah, and I think like there is often so much like terminology that's thrown around, right? Like we'll often hear fat phobia, we'll hear weight stigma, we'll hear internalized fat phobia, internalized weight stigma, anti-fatness, anti-fat bias.
Mhm.
And I think, sometimes, right, it's like there's so many different terms and like the actual message behind them, like the actual definition, the actual, you know, like understanding of what it really is gets lost in how much jargon
Yeah.
that this community just kind of throws at people, and it's so overwhelming, and then we're like, I don't even know what that means, it's too much, I
Mhm.
don't even want to look at that. So I thought, maybe is it okay if I like define a
Yeah.
little bit of like what those mean?
Please do. Yes. Yes. Absolutely.
Amazing. So yeah, this is like a hot take, and I kind of have a soapbox about this, but roll with me on it. So, if you actually look up the definition of fat phobia in the dictionary, what it'll say is it's an irrational fear, aversion to, or discrimination against obesity or people with obesity. And I'm going to use quotes because, again, I do not believe that medical or bodies should be medically pathologized in any
Mhm.
way. I do not use the words in my practice, but again, for the sake of the definition, that's kind of what it boils down to.
Mhm.
And if we were to like take that word apart, right, and separate that out as fat and phobia, it makes sense that it's a fear of fatness, right?
Yeah.
And again, I think it's like a hot take, but I actually prefer to not use the term fat phobia. And instead, I prefer to use the terms anti fat bias and anti fatness, which then, if we look at the definition of that, it's so much different than the definition of fat phobia, which is
Mhm.
really interesting to me. The definition of anti-fatness is terms that describe the attitudes, behaviors, and social systems that are designed to specifically exclude, underserve, and oppress fat bodies.
Mhm.
And it's a term that can be used to describe individual biases as well as institutional and system biases.
Mhm.
So we are like really broadening the definition of that,
Wow.
right? And I think that, where this all comes from for me is I don't know if people are familiar, but there's an author and a fat activist and a writer named Aubrey Gordon. Her pseudonym is Your Fat Friend,
Mhm.
and she's amazing, an amazing writer, and oh my gosh, has done so much great work in, really speaking to the harms that she's been through with weight stigma and an anti-fat bias in her own life, but is doing such great work and advocating for other people as well. But she really kind of takes a stance of like, it's not, a phobia kind of implies it's a mental health condition to fear something.
Mhm.
And it's not a mental health condition to fear fatness in the way that we've been taught that it can
Mhm.
be, right? So
Mhm.
anti-fatness is like a systemic form of oppression, right? Weight
Mhm.
stigma is systemic a form of oppression. And I think that, kind of calling it fat phobia, right, and having it be akin to like an anxiety disorder or a mental health condition is
Mhm.
one way that we kind of really reduce kind of
Mhm.
the ways that fat phobia, or again, I like to say anti-fatness, sort of ripples out into every single part of our life,
All the systems that it shows up in.
all the systems.
Mhm.
Yeah, especially like the medical system.
Yeah, so much in the medical system. And also, and I'm of course not in school to be that medical provider, but I would imagine it's not discussed a lot. You can share because you are in the process of becoming an NP, but it feels like, or at least it wasn't spoken about, docs really don't really know what we're talking about when we're trying to provide education around, health at every size and the importance of being fat positive, right? Docs don't super get it. So there's a missing piece. There's a missing link, right?
Oh my gosh. Yes, totally. I mean, even in like, I mean, dietetics was my first career, right? So like my trajectory was I became a dietitian before, and then I did nursing school, and I'll say for both, and also an NP school, right? Like it's not discussed. I have actually seen some improvements. Like I took pathophysiology this past semester, for example, a master's level course in that. And while there was a lot of problematic things that were brought up, I was actually surprised in that class. And I also took another like physical assessment and clinical decision making class. But there were some mentions of eating disorders, and there were some mentions, right, of, weight stigma and anti-fat bias. And I was like, whoa, this is progressive.
Like, hey,
I know, but I would say that traditionally, like 95% of the time, people are not really truly taught what it means and how it can show up. But I think, like, one of the big ways that it can show up is, I mean, we have so many studies on this, and it's so incredible to me that, like, despite all of this research and despite all of these studies, it's still not being translated into clinical practice.
Mhm.
But, like, studies show that, doctors have been shown to have shorter appointments with patients in larger bodies. They often withhold warmth from patients in fat bodies. So by that, I mean their social signaling, right?
Mhm.
Their
Yep.
social signaling kind of sends a message that there's a threat or there's fear or there's disgust. And this can show up like having closed off body language, sitting farther away from fat patients, not actually touching, people in larger bodies. I mean, a
Mhm.
big part, I remember one of the first assignments that I had to do in my advanced physical assessment class was, oh, I'm forgetting the name, but the general idea was we had to watch a TED talk done by a physician talking about how powerful the act of physical assessment and actually touching a body can be, not only in being able to identify and assess for things that need medical intervention, but also to be able to truly like connect with the patient and just talking about how healing that touch can be. So if we're not even doing that as medical providers, number one, I would say that that's medical negligence.
Mhm.
But number two, right, think about relationally what message that sends to our nervous system
Yeah.
and like our place in this world, right? My provider doesn't even want to touch me. That hurts. And I think
Yeah.
that like it's so hard too because doctors and nurses are often not as willing to share health information with people in larger bodies as well, which is such a disservice. And that's a form of oppression, right? Like, oh, I'm less deserving to have all the information and to be actively able to consent in or consent out of certain, interventions that you're providing me or certain recommendations that you're giving me. How am I supposed to do that if I don't actually have all the information?
Yeah.
Which is really concerning, right? And
Yeah.
then I mean nurses. Nurses are really challenging too. Yeah, like a little personal tidbit about me is that my mom was an ICU nurse. Sorry, mom, if
I
you're
see.
listening to this. I'm talking about you. You probably listen to it, but it's fine. But she worked as an ICU nurse for 40 years, right?
Wow.
And yeah, nursing runs in my family. That's like a whole
Yeah.
other conversation that we could have. Right, but nurses and my mom has listened to me go on my rants and my rampages and has had some openness to my education on some of this. But again, like 40 years of working in an ICU, right? And I mean, again, we could talk about that for forever, but nurses definitely make assumptions about people in larger
Yep.
bodies the same way that doctors do.
I mean, even all the way back to like the medical assistants that are often, like bringing people into the waiting room and doing the initial, I don't know, questionnaires or whatever they are. Like it can start there, right? The getting on the scale or requesting to get on the scale, and then the comments about if the number is higher or lower or what it means, and then comments about their own bodies, right? It can get really yucky really fast.
So fast, so fast. And it's just like, wait a minute.
Like, how'd we
Like,
get here?
yes, how did we get here? How did all of a sudden you have now commented on my body size? You made assumptions about my eating behaviors. You made assumptions about my exercise habits. You made assumptions about my all the things, my abilities, my life, my resources, and you've also made assumptions about like what I want to hear from you,
Yes.
right? And like you're now bringing in this, like you're bringing in yourself to this situation, right? Like I did not ask you
Mm-hmm.
to bring in, what your personal views are on nutrition or weight or health or body size in this moment, right? Like what makes you feel like you're entitled to inundate me with that
Yeah.
information without asking me first, right? Can I talk to you about your weight, or can I talk to you about your, nutrition, or can I talk to you about your movement patterns? Can
Mm-hmm.
we even have this conversation? We just
Mm-hmm.
steamroll way ahead of that and we assume that, again, because we live in diet culture, and I think it's what we're talking about so often throughout the day, it's almost like, right, neurons that fire together, wired
Mm-hmm.
together. We're just
Mm-hmm.
conditioned to talk about it in every single moment of the day.
Yeah. And I'm just thinking of consent. Diet culture sinks in and seeps in without our consent, right? These comments, these questions, these assumptions, there's no consent for this. So just thinking of reclaiming, right? How can we support folks to reclaim their autonomy and saying, like, yes, this is okay for me, or no, this is not okay for me. Actually, I didn't ask about your Weight Watchers attempt last year. I don't think it's called Weight Watchers anymore, but whatever it is,
WW, whatever.
Yeah, it'll change tomorrow. Like, it's fine.
I'm like, oh my God. But yeah, especially as it relates to like you in the context of like you saying this as it relates to like my body in the room. Right?
Yes. Yes.
Like that's so strange, But yeah, I heard on a podcast like years and years ago this idea of like, yeah, I think it's twofold. Not only do we not consent into diet culture, but people with eating disorders don't consent to have eating disorders.
Yes.
Right?
Yes.
Like
it's not a choice.
Yeah, I'll tell my patients all the time, like, show me the document where you were informed of all of the mental, psychological, social, financial, relational, all of the consequences that you might face because of your eating disorder. Show me where you were told all of those things and where your signature was.
Right.
It doesn't exist.
Yeah, of course.
So I think, yeah. Oh my gosh. Doctors do, and like all medical providers, I think do a really, really poor job of actually practicing again, right? Like it goes back to what we were talking about earlier. We can be informed of the process of informed consent, but what does it actually mean to be conscious? Am I actually providing the education? Am I actually providing the resources? Am I actually providing all of the options for this person to truly, truly consent and to have body autonomy and body sovereignty in this moment? Because if I'm not giving them all the information, if I am not cultivating as much openness and as much dialogue and as much conversation about this as I would want to have for my loved one, then it's not informed consent.
So how do you feel like folks who are living with an eating disorder, how do you feel like they could advocate for themselves differently or maybe for the first time in medical settings? What are some tips or strategies or tools?
Oh my gosh, I could talk about this forever too. I think like just to start, this isn't like a tip or strategy, but I think that like we just have to acknowledge like how really sad, like really, really sad it is that this is the patient's responsibility.
Yes.
Right? Like the onus should not be on the client. The onus should not be on the patient. And I think that's really sad that like 99% of the time it is.
It is.
And like white coat syndrome is such a thing, and I think that like when we see people with a lot of credentials behind their name, myself included, when we see people in white coats with stethoscopes, it makes, I think it does something to our nervous system.
Yeah.
I think that like, white coat syndrome truly is like nervous system dysfunction because we just get so activated, right? Go straight up into fight or flight around that. And I also think that like it's a privilege to be able to advocate for yourself in a medical setting. So something that I've been thinking a lot about is like, let's say that somebody's in, I don't know, like a rural area and does not have access to a variety of different treatment providers or treatment options, then advocating for yourself could actually be a threat to getting the medical care that you so desperately need. Because what if you were advocating for yourself and then again, the physician, the doctor, the NP, the PA did not like the way that you advocated for yourself and had a really carceral, paternalistic approach to care. And again, not all doctors approach care in this way. There are some who unfortunately do. And so then what happens, right? Then what happens if you advocating for your needs and your values actually inhibits you from getting some of your basic medical needs met as well? And I think that that's a really tricky situation.
Yeah.
Right. And so I think that if we have the privilege of being able to advocate for ourselves, is number one, acknowledging that like not everybody will be reachable or teachable.
Yep.
In that moment.
Or ready.
Or ready.
Mm-hmm.
We have to think about stages of change, right? When I'm about to go into like a session with a client, I always think about what stage of change might they be in, right? What were they in last time? What what are the stages of change, right? What kinds of things do I need to remind myself about all the stages of change? And then I just reflect on like when I've been asked to make big changes in my life, right? Like what were the barriers? What were the things that I wish I had been asked, or the ways that I wish it had been approached that it wasn't? But yeah, like some medical providers are not going to be in an action-based stage of change in order to be receptive to the information that you're providing, and they might shut it down, and that's really hard.
Yeah.
And so in that situation, I would encourage you to bring like the grief and the anxiety and the frustration and the fear and all of those really difficult emotions to your primary treatment team, therapist, dietitian, so you can really process those. But another thing I think is there are actually like cards that you can download. I have tons of resources on this if we
Mhm.
wanted to like link to it in the show notes.
Yeah, definitely.
Um, but there are various, cards that will kind of express what intuitive eating is, what health at every size or haze is, what a weight inclusive approach to care is. And then they have some specific ones. I think I have some from morelove.org.
Mhm.
If you're familiar with that organization,
Yeah.
that are don't weigh me cards.
Mm.
Please only weigh me if it's medically necessary. And this is what would meet the criteria for medical necessity,
Yeah.
right? So, am I getting a
Crystal
medication?
clear. Yeah.
Yes. Am I getting a
Yeah.
medication change, and is the medication weight based? And do I need anesthesia? Do I have congestive heart failure where I'm going to be
Mhm.
fluid, and we need to monitor that as that weight change is fluid based and will give me insight into the progression of my congestive heart failure, right? And there are a number of other conditions that are chronic, and we would need to be monitoring that. But
Mhm.
I would say for the majority of the population, right, weight is not going to be a useful measure. It doesn't really tell us anything besides our relationship with gravity. So sometimes it can just feel calming and feel a little bit more safe to be able to have something tangible to give to every member of the office. So
Yep.
going up to the receptionist and saying, these are 2 cards, these are what they are. I would like for you to read them, and I would like for you to deliver them to the nurse and the doctor who are about to engage with me during this medical encounter. And then having some extra copies, if somehow that got lost in translation, to being like, "Hey, before we proceed with this medical encounter, could you please take a moment and read this card for me?
Mhm.
Happy to answer any questions that you might have." So you're kind of setting that boundary. I
Mhm.
know that's so scary, and I know that's so hard, and I think it can be super empowering. Of course, too, like you can have your treatment team call up your doctor's office and really advocate for you too as well, and try to provide some education provider to provider, and that can be really helpful. I feel
Yeah.
like the more tools and strategies we kind of stack on, and the more that they're kind of hearing this and they associate, certain modalities or certain ways of thinking with certain cases, right? Like, oh, multiple people are telling me that this client is not appropriate to be weighed at this
Mhm.
visit. Maybe they'll be a little bit more receptive to that, right? And like, I think too, if a doctor, so a couple different things. If a doctor or a medical professional, if a provider ever says that you are required to be weighed at a visit for them to get reimbursed or for it to be covered by insurance,
Right, like billable. Yeah.
yes, billable, that's inaccurate. You can tell them refused weight today, and that is perfectly acceptable, and it still provides a billable medical encounter. And sometimes there's pushback about that.
Oh,
And I
yeah.
would just need to reiterate,
Mm.
I am not being weighed today. If you would like to document my refusal, please do so.
It's so hard. I know often folks kind of freeze in those situations, and just like be the good patient, right? Do what they're supposed to do. And sometimes I think about how if you know yourself, you know your nervous system, you know that might be your response, how can you prepare yourself to maybe like reduce some of the harm that's going to be done by the resistance that you're going to meet, or even like stepping onto the scale, getting the printout with the numbers on it. There are some ways that you can reduce that internal harm that happens because things just don't feel safe. And that is just a trigger for most people who are living with an eating disorder, right? Like things just don't feel safe.
Yes. Oh my gosh. Yeah. I think that like the nervous system work, is so important before, during, and after the visit. I mean, there are so many different strategies that we could talk through. I think that like if at all possible, like bring an advocate to
Mhm.
the appointment with you, even having like a safe person be in the waiting room with you and be able to offer you that support and that validation and just that sense of like calmness and, I'm not
Mhm.
alone in this can be so incredibly grounding. I think that like other somatic practices can be so grounding too, whether it's like some essential oils or doing some breath work in that moment,
Mhm.
or whether it's, doing some progressive muscle relaxation that's, maybe a little bit more subtle. One that I really like too, which, I think is pretty discreet sometimes, right? But is putting like our hands underneath our armpits and kind of just like
Mhm.
rocking a little bit back and forth
Mhm.
can be really helpful.
Things that
It's
like
so
help you maintain contact with yourself, right? Contact with yourself, what's true for you, what you might be needing, even if it's not super present, but it helps you just stay a little bit more, right? Giving yourself some semblance of safety in an environment, a setting, an interaction that maybe feels super unsafe for you.
yeah, and like knowing your limits too, right? Like
Mhm.
I think it's so important to kind of like know, okay, when have I entered into this place of dissociation? Or when
Mhm.
have I really entered into like this unsafe place for me? When does this feel like too much? I know again, like it takes privilege to be able to like schedule and reschedule appointments
Mhm.
too. But I think sometimes we can almost, again, kind of like the good patient, try to force
Mhm.
ourselves past our limits because
Yeah.
it would disappoint the medical provider, or our dietitian said that we really needed to, get that PCP appointment, or, the therapist is concerned, or in order to go back to my sport in college, I have to have this. And this was the
Yeah.
only appointment that the doctor had. And it feels there's like this sense of like scarcity or deprivation with doctor's appointments because I think that there is, right?
Mhm.
I mean, you only have 8 minutes for a typical
Right.
appointment.
It's
Like that's
wild.
activating for my nervous system already,
It's
thinking about
wild.
it's so wild, right? And so it can feel like this scarcity type thinking can come in, right? This is my only chance. I have to do this. And if I don't do this, then what am I going to lose out on? And then that can make us feel really fearful to advocate for ourselves because then not only is like there's this pressure of I have to make this appointment so I then get X, Y, and Z, but oh my gosh, I have to also stand up for myself at the same time. And I can't just be like
Mhm.
this passive participant. I think that is really, really challenging. But again, like knowing your limits, right? So if you need to exit the suite for a little while and call a support person. If there is that time, doctors notoriously run behind.
They
So
sure
if you
do.
take like 3 to 4 minutes to do that and just have
Mhm.
somebody kind of on call for you, like, hey, friend, I'm going to the doctor's tomorrow. I have an appointment right smack dab in the middle of the day. I know that they're usually running really behind. If I call you between 1 and 2 p.m., like, would you have the ability to just answer and talk with me for a couple moments? Sometimes that's really all it takes to be able to like get that validation, get that support, kind of bring our nervous system back into that window of tolerance so
Yeah.
we can feel a little bit more grounded, just a little bit stronger going into that appointment.
And lots of stuff to work on with your treatment team, right? Like lots of ways to resource yourself through, imagined things and through, tapping into your body or,
Experience.
yeah, like
Yes.
anchor objects, lots of ways to try to just like stay with yourself a little bit more.
Yeah,
Yeah.
as best you can, and it doesn't have to be all or nothing, we don't have to
It's,
fully stay present
mhm.
in
Mhm.
that emotion or in that experience, right?
But what feels good, right? Like, and maybe none of it feels good. And like, that's okay. It's all just these really brilliant ways that our bodies protect us from more harm. But knowing what feels right for you and trusting that just
Yeah.
always feels so important.
Yeah, I know Dr. Gaudiani, she's the author of Sick Enough. She talks about a lot in some of the podcasts that she does a framework of just 3 simple questions. I posted about it on social media before, but just asking yourself, right, what do I need in this moment? How could I see this need through any shame or resistance that's coming up for me? And how could I meet this need? And even if we don't have answers to those or we don't have the best things or ways to meet those needs in the moment, that would be ideal. Sometimes just like asking ourselves those questions can generate a little bit more self-compassion and can kind of bring us back down if we're able to really sort of just again like come back to the self, to the body versus right into some of our thoughts and spiraling or whatever it might
Mhm.
be.
Yeah, whatever kind of vortex could be on the other side. Well, I don't want to take up too much more of your time, but we just have a couple questions from Instagram that I
Yeah,
thought we could maybe cover, if that's
sure.
okay.
I'm ready.
All right. So the first one is how to deal with necessary dietary restrictions while in recovery. For example, celiac disease.
Oh, that's a hard one. Oh, I have so much
Mhm.
compassion for anybody who asked this. I don't know if the person who asked this actually is going through, celiac right now and maybe has been recently diagnosed, but I think it's so challenging, regardless of if that's you who's going through that, right? Trying to navigate eating disorder recovery with a co occurring medical condition that does require some medical nutrition therapy. And I think it can be equally as hard to help support somebody who's going through eating disorder recovery and also
Mhm.
has medical nutrition therapy needs. I think the first thing that comes to mind is like talking about it. Right. So I think that there can be a lot of shame associated with being in recovery and also, maybe the recovery doesn't look like the recovery that we see on social media, right? Like maybe food freedom and some of the principles of intuitive eating and gentle nutrition and the way that we are navigating with ourselves, our self talk, our needs looks a little bit different than the highlight reels of recovery that we see again online.
Yeah.
Right. So just really talking about it, I think that like talking about it helps reduce shame, right? We know that Brene Brown talks about how empathy is the antidote to shame. So I think if you're experiencing any kind of anxiety with it, like talk to your treatment team about it, of course. I think that like, sometimes it can be helpful to reframe restriction as maybe like changes, maybe some changes to our nutrition that are going to be supportive for us versus restrictions. And I don't think that restrictions all the time are restrictive. Like, I think that sometimes, under some situations, engaging with it can be like a form of self care and can be a strategy to really develop more self understanding, really engage in gentle nutrition, really engage in a different type of self care than again I think is just a watered down version. Sometimes recovery can feel like a watered down version that we see on social media. So that's what I would say. And I would also say that like a big part of this, and I can talk about some nutrition strategies in a moment, but like grieving that recovery is maybe going to be a bit more complicated for you, right?
Yeah.
I think that like that makes so much sense. Eating disorder recovery, I think, is one of the hardest things that a human can do. Truly, like one of the hardest things. And oh my gosh, it's already so hard. Now we have this other thing, this whole other
Yeah.
component that like is gonna send our brain just in like, oh my God, I'm like, it's like sparks. Like so much dysregulation can come with that. It can activate the eating disorder voice, right? It can activate, all those emotions, shame and guilt and fear and anxiety. And when we already have fear and anxiety around food and eating, now we have this added, layer of celiac disease. So I think that
Yeah.
that's so hard. I think, doing a lot of self-compassion, doing some grief work around that too, bringing that to your treatment team is going to be so healing. And then practicing some radical acceptance, right? So maybe we don't like the situation, right? Maybe we wish a part of us which it wishes it would change. But really thinking about, what can we do to radically accept that this is sort of where we are right now and how can we meet our body's needs without shame or resistance. And then like nutritionally, just thinking about this as how can I be as least restrictive as possible, right? So how can I really incorporate all of the gluten products that I would normally eat, but maybe swapping those out with some gluten-free products, right, that we can get at the store. I think it's so incredible how many gluten-free products are actually available now on the market. Like they're
Mhm.
everywhere. And I
Yeah.
think that's really awesome, and we have so many more options now that we did, like, even 10 years ago.
Mhm.
So I think, just working with, like, your treatment team or your dietitian on where do I find these products? How do I incorporate these in a really recovery-minded way? How do I make meals for myself now using these
Mhm.
products? And then I think there's a whole added layer that we could talk about forever too around
Uh-huh.
what does that mean for social eating?
Mhm.
Right? What does that mean for
Mhm.
eating out? And what is it gonna mean for me with my eating disorder if I
Mhm.
have to constantly check food labels or, kinda be hyper vigilant in some ways about my food intake as a form of self-protection and self-care versus as a form of self-abandonment or self-sabotage. And
Mhm.
I think holding that, like, really doing that mental work around that is so hard and so complicated, and this is, like, a huge forced lifestyle change, and it makes so much sense that it takes some adjustment, some trial and error, some, couple steps forward, a couple steps back, right? So just giving yourself a lot of grace and compassion with that too, and just giving yourself some space to be able to, like, have struggles and have challenges.
Mhm. Yeah, so much nuance. That was such a lovely response to that question.
Thank you.
Yeah. Yeah. And the last one that we have is just how to navigate providers blaming all of your medical concerns on your eating disorder. Another really nuanced question, which we could
Um
probably do a whole nother podcast episode on.
Yeah,
But
we totally could. Maybe one day we will, but I'll give you, like,
uh,
a too long, don't read answer for this that's just coming to my mind. This, like, gives me full body chills when I think about this, right? I think that, like, what we're really talking about here is medical gaslighting,
Mhm.
and I know that there have been a ton of articles on this recently. I remember, I've talked about this in various different settings before, but that is so hard. It is so hard, gosh, and, like, again, everything that we talked about today, I think makes it so difficult for us to be able to advocate for ourselves. I think one thing that really comes to mind is if a provider is blaming all of your medical concerns on your eating disorder, is asking, "What's your differential diagnosis?" Right? So if we could prove
Mm.
right now that if it was not my eating disorder, what else could be my symptoms? What else could my symptoms be attributed to? So what's the differential diagnosis? And then asking, right, like, how have you ruled those out? So tell me how you have come to this conclusion as a medical provider that it must be my eating disorder and not another differential on your list. So asking, what's the evidence for and against all these differentials? And that can be really powerful is just asking them to kind of speak to their clinical decision making because
Mhm.
I think so often there unfortunately is not a lot of clinical decision making that occurs when we see eating disorders and then
Mhm.
all these medical complications, right? It's just, oh, that's the eating disorder. Yep, okay. Make your doctor, make your provider use their brain a little bit, you know?
Uh-huh.
I know
Yeah.
that's really scary and I have so much
Mhm.
compassion for that. And you could even, like, role play in session with your therapist or your dietitian if that's coming up for you. You can, like, have a note card with these
Like
questions.
write a script. Yep.
Write a script, yes, absolutely, and I think that, like, that's also something is, you can make a plan for your visit, right? So you can make a list of everything that you wanna talk about during that visit, you can make a list of the goals for the visit, you can write down questions, you can write down a symptom diary, you can do all these things to kind of provide evidence or at least provide a little bit of support that, no, it might not all be my eating disorder.
Mm.
You can bring somebody with you, like, you're allowed to have an advocate in doctor's appointments as long as there's consent there and you're like, "Yes, I am fully consenting. I would like this person to be a part of this medical visit for me." Because again, like, if you're in fight or flight, just to bring more light to the nervous system component to this, you're not gonna be able to access your prefrontal cortex,
Mhm.
right? Which is the logic system of our
Yep.
brains, right? We cannot operate from that, right? If you are sitting there and you are like, "Oh my gosh, they're blaming everything on my eating disorder. I'm feeling my heart rate increase. I'm sweaty. My blood pressure is dropping. I'm feeling dizzy." How are you gonna remember what a differential diagnosis is, let
Right.
alone how to ask that? Bring somebody with you and maybe, like, tap their knee or something, having some sort of little code or little signal between the two of you, that can be a moment for them to be like, oh, I need to take over for this person right now.
Yeah.
I think that that can be a powerful way to send safety to our
Mhm.
nervous system too. I think that you can also, if the provider is blaming all of your medical concerns on your eating disorder, ask for a detailed record of that visit. And so by that, I mean, unfortunately, oftentimes what actually happens in a medical visit is not dictated, is not charted in
Mhm.
a way that's grounded in reality.
Yeah.
Right. So I would really, you can ask for all of your medical records. So I would ask for a detailed record of that visit if you felt medically gaslit, and ask your doctor if they can record in the chart if your specific concerns weren't addressed and the reason why. Again, making them kind of use their brain, right? And
Mhm.
really, 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 being able to say, this is not, I know this is so hard, but I know that this is not what we talked about during this visit.
Mhm.
These concerns were not addressed in the way that you charted. I would like for you to change this documentation. And
Mhm.
they would have to go back and change it, because
Yeah.
that stays in your medical record and can inform then the way that future doctors are going to
Yeah.
be approaching your care. Those are some of like the initial thoughts that come to mind. And then just looping
Yeah.
it right back into what we were talking about in the beginning, right? Do not blame yourself for this. Do not, internalize all of that blame and do the same thing that the doctors are doing to you, right? This is really real. And
Mhm.
having a eating disorder specialized primary care physician or nurse practitioner in your corner, it will feel validating and it will not feel patronizing. So
Mhm.
again, just hold on hope that those people exist in your life, or you
Mhm.
could find them, because my hope for everybody is that they will find a primary care doctor who is able to validate their eating disorder and not just blame all of their medical concerns on the eating disorder.
And I'm so looking forward to the time that you'll be one of those primary care providers in our community.
Just about, well, we'll say like maybe a little more than a year
Oh,
after I get my board. So hang on, wait one more year, and then I'll
you've
be
got
certified
this.
in practice. So stay tuned
Yes.
for that. But yeah, really excited to do some more of this work. But yeah, ask what
Yeah.
your differentials are, ask how you rule them out, ask evidence for and against, and yeah, bring a support person and make a script before the visit.
Yeah. And I think too, just for your relationship with yourself to come back to this like trust and hearing and acknowledging that there's a part of you that's saying, like, wait a minute, this doesn't feel right. It doesn't feel like this is super connected. It doesn't feel like this is all that's going on. I feel like that kind of, like bid for a relationship with yourself can be super healing over time. Hard at first, yes. And over time can really, really make a difference. So trusting yourself, we know that eating disorders are disconnecting, and these little bids for connection with yourself, really, really important.
Yes, and like self-validation, right? It's like use your own history to guide your self-perception as well, right? Like if this started way before the eating disorder, right? Maybe it's a medical concern that's been exacerbated by the eating disorder, but it started before the eating disorder, right? Or it started
Mhm.
before the eating disorder got more intense, right? So again, just sort of like almost fact checking a little bit, right? Because it can be so disconnecting to have somebody kind of force you into a reality that is not yours. And we
Mhm.
have to be like, okay, what are my strategies to, again, like you're saying, bring me back to the self, reground me and reroute me in my own experience in my body, right? Like you are the expert in your body. Doctors are
Yeah.
not, dietitians
Mhm.
are not, nurses are not, therapists
Mhm.
are not.
Right.
So if you're noticing that you are feeling more disconnected to yourself, your values, your body, all the things after that appointment, check the facts
Yeah.
and, really rely on your wisdom and your own knowledge of your body in order
Mhm.
to kind of be able to then make the next best step for yourself.
I feel like we could talk all day, Rachel.
No, I know. Like, won't even cover the tip of the iceberg.
I know. You'll have to come on again and we'll pick up where we left off.
It's good. I know I told you at the very beginning, I was like, you're going to have to cut me off.
I love it. There's so much to say, right? Such important information and just like education. And yeah, knowledge for people to have, because this stuff is so hard and eating disorders are hard enough. Facing medical systems that are oppressive and gross and harmful. I could say gross 7 more times, but right, like,
Oh,
yeah, it's so gross. So
yeah,
harmful. Yeah.
so harmful. And like, you're not
Yeah.
alone. Like, you're not
hmm
alone in this. It sucks, right? And I wish it weren't this way, right? But you're definitely not alone in this world with that. You know, it's unfortunately a common experience, and there is support out there.
Well, to finish up, why don't you tell everyone where they can find you on the internet? A couple different places.
Yeah, totally. Yes. So I have a private practice. So you can find me at www.liberatedplate.co. I'm not accepting any new clients right now, but my fabulous business partners are, and they would be so happy to work with you. And, you know, just if that's not an option or something that you're interested in, point you in directions to get support or, you know, have more resources or what have you. So that's one way that you can find us and engage with us. We're also on social media at Liberated Plate Nutrition on Instagram, and we put out content. We try to almost 6 days a week. So that can be a nice eating disorder resource for you as well. And I think those are the two best places that you can find me.
Well, thank you so much. It was such a privilege to have you on to talk about this when folks were asking for more information on medical stuff and eating disorders and the team we were talking about. Who can we have on? I was like, well, Rachel would be perfect. So we're so happy that you came on to chat, to share your wisdom and your expertise and all of the things. Thank you again. And everybody, we will be back next week for another episode. So we will talk to you then.
Bye.